Patient position. Is he in a good position?
Yes.
Are you comfortable?
Okay. Is he comfortable? I don't know. Are you comfortable?
I'm pretty good.
He's pretty good. So that'll work. So therapist position, where do I want to be? What's my stance? Let's talk about my stance. How am I going to stand? Look at the picture. How am I going to stand? I want to be like this.
Staggered.
Staggered stance. Beautiful. So if a staggered stance, I find easier, not this staggered, not my forward leg being on the inside. My inside leg, I find easier to be on the back leg on the inside. That way I get closer to him, closer to this table. Okay, hands. Where's my stabilizing hand?
Anterior shoulder.
Is that my left,
Oh.
my inside or outside hand?
Outside.
Outside hand. So, and it's on the shoulder. The thing I want you to be careful of is on the shoulder, yes, I'm going to move a little bit over so I'm not blocking. What's one of the elbow flexors? Well, what's one of the other big elbow flexors with supination is?
Brachioradialis.
Biceps is the one that I'm, no brachioradialis, but I'm it is one, but I'm talking, I want to get onto the, because I'm at the glenohumeral head of the humerus. What I want to be careful on is what? Muscles. The tendons of the biceps, for example, especially the long head, which goes directly over, that I don't irritate it. So that's, I want to either cup my hand on the head of the humerus or slide slightly over onto the lateral side so I'm on the, stabilizing the scapula by being on the coracoid process area. But again, that's the short head of the humerus, and what else attaches to that? Coracobrachialis. That's right. So we want to be careful of those structures when we're applying our resistance pressure. Now, my stabilizing, that's my stabilizing hand, right? My resistance hand goes where? Wrist. As distal as I can on the limb being moved without crossing joint lines. So, if you take a look here, I'm going to be this way. Now, sometimes what I'll do, it's not wrong, you can just relax your hand. So he's staying relaxed. I can support with one finger. I can take that, I'm applying all my force, but I'm applying some support to the wrist, that's all. If I have one finger on there, I'm not applying resistance on the wrist with one finger. Some purists may say that's crossing the joint line. It's not, it's supporting. My force is coming from here. I have some motor coordination to tell me that I'm not applying force there. I will trust you have some motor coordination to tell you that you're not applying force there. It's a supporting thing. Because patients don't want their wrist flopping in and out. They don't know what to do. And I don't want them applying a lot of force through the wrist either. Okay? So we're going to go from here. So elbow is going to go from here to here, right? Okay? So match my resistance. And now match my resistance back for an eccentric contraction. I'm lowering myself down and I'm coming up using weight shifts, right? So isometrically, I could, don't let me move you. Okay, good. Is it comfortable? I'm watching his face, no problems there, right? That's elbow flexion. Elbow extension works on the triceps. Do I want to do it in the same position? Technically, I could get some of it from here to here. Oh, it's a better position. Prone with that arm over the edge, right? Okay, switch on your tummy. Get rid of this one. We need a towel. This is where we need the towel. I want you to slide that way slightly, right there. Bring your arm over the edge here. We need a towel for your forehead and a towel. Where's the other towel?
I don't have no towel.
It's over here on the table.
On the floor,
That's
underneath the shirt.
Okay, guys, remember we don't want to put the towels on the floor because your patients won't appreciate that.
That's okay.
Do you mind it, Justin?
Keep it on the floor.
There's for his head to make it nice and comfortable. I want to make sure that his arm extends over the edge of the table. Now, if you look at the angle of the arm, it's dropped down. I want to keep that arm, the humerus, parallel to the ground. So we can do that by applying that. Now I'm a little more comfortable. You comfortable there? Put this arm where it's comfortable. Is it good that way? Now let's get you straight. What am I doing? I'm making sure of my patient position. He's in the correct position and he's somewhat comfortable, right? So, in this position, where is therapist position?
Below the arm.
Where am I standing?
Oh, staggered.
Staggered stance where? Am I this way?
No, inside leg back.
Parallel.
Am I this way?
No,
Parallel with the table.
Am I this way?
no.
Am I this way?
Yes.
Yes. Parallel with the
Okay.
table.
In this case, I could be this way too, as long as I'm thinking about I'm not this way. Seriously, I mean, you get people that will do that, so just making sure you're not. So I want to be over here beside him. I want to be supporting him. Where's this hand going to go? Stabilizing hand. Distal end of the humerus close to the elbow. So I'm going to be here. Yes. Resistance.
Wrist.
Distal as possible without crossing the joint line. From here, I now can just relax. If he's over far enough, we can go from flexion, and I can now bring him into an extended position, right? So, I want you to match my resistance by straightening your arm. There we go. And I just shift, and then down we go. Match my resistance down.
I have a question.
Yep. Okay, so did you notice I started here with a grip here, and then because my motor brain had shut off temporarily, and realized that's not a comfortable way to resist him, for him, is it? If I relax your arm, and I add a more broad, flat surface, high-lows are great. If I don't, I have to squat down. Now, match my resistance. Is that more comfortable than what we did? Much more comfortable. And match my resistance back down. Match it. Don't let me. Nope, we're done. He gave you an extra one. That's why I want to stand to the side, right? So make sure he's comfortable, make sure he understands the instructions. The instructions are short and simple. Yes? What's your question?
Would you support his shoulder? Not at all.
You can, depending on how high he is. Is it comfortable here, or you could put a wedge under there. I love mobilizing wedges. If you look at picture, we don't have any here, I think. I can't remember if we do or don't. Are we on this page? No, this is the one I drew. I did on a copy. I drew a wedge thing. Actually, we could go this way. It would be much more comfortable, probably. You're absolutely right. But this is a narrow towel.